I first learned about LifeSpark I think it was about 5 years ago, when UCH teamed up with you and LifeSpark to provide volunteer services of Reiki and Healing Touch to patients in the cancer center while they were receiving their chemotherapy treatments. It was clear pretty quickly the benefit that I could see in the patients while they were receiving these treatments. They were visibly more calm and relaxed. They oftentimes fell asleep during their treatments, which is the ultimate compliment to any nurse. A relaxed patient is a relaxed nurse. And not only that, but you could see the effect on the caregivers that would oftentimes accompany them to their treatments. They would sometimes say things like, wow, this is the most relaxed I've seen him or her in quite a while. And they were so thankful to finally see their loved one at peace and relaxed during such an incredibly stressful time during their life. I had a patient who I took care of quite frequently, and she typically had some problems with her infusions, and it wasn't real clear what was going on. Her symptoms would be shortness of breath, chest tightness, rapid heart rate, just being very nervous. Obviously can be signs of anxiety, but as medical professionals, we had to respond medically, not knowing if she was having any sort of reaction to her treatment. So one day I had an idea. There was a Reiki and Healing Touch volunteer there that day. And I said, can you please provide Reiki for this patient while she's getting her treatment? So they did that, and she sailed through the treatment. She had no symptoms, and she even fell asleep. She was so grateful, as was I, because it certainly made my job easier. So it was really heartwarming to see the effect that it had on her, and how we were able to implement the same technique with other patients who had kind of a similar scenario going on. Anxiety can just be huge with a lot of these patients, especially as they're first entering their cancer treatment journey. So to be able to provide them that extra 15-20 minutes of some rest and relaxation for them has just been great. It has saved a lot of stress and anxiety for the nurses, a big part of an oncology nurse's job is to provide that emotional support and to make them feel safe and secure. And for the Reiki and Healing Touch volunteers to be able to take that piece off of our plate has just been a real win-win and a time saver for everyone involved. COVID was just a huge game changer for LifeSpark and the Healing Touch and Reiki program. Obviously, the volunteers weren't able to be there for a very lengthy period of time, but everyone very quickly adapted. Sandy started providing distance Reiki services for a lot of the patients, so they were able to still receive the benefits of it. And now, post-COVID, now that the volunteers are back in the infusion center and the patients are able to receive their treatments again, it just is really a testament to the adaptability of the program, and just how the patients were still able to are now benefiting again from in-person treatments, and how we were all able to overcome a seemingly insurmountable obstacle of a pandemic. LifeSpark has now provided Reiki training to 2 cohorts of nurses in the cancer center, and the results have just been remarkable. Nurses are now feeling empowered with just one more tool in their tool belt for being able to not only take care of themselves and their family and increase their work-life balance and their own emotional inner calmness and stability, and that just has a trickle-down effect to everybody involved. They're coming to work a little bit happier, a little bit more grounded and centered, and that has just been a lifesaver for a lot of different nurses.